Tonight for our mini session, again, reminder, this is not for CE, but really more informational webinar to teach you more about my philosophy as an adjunct instructor for the Dawson Academy. So we're going to be covering beyond the prophy, innovations in hygiene that are really shaping the future of care. And of course, I want to thank the Academy for having me this evening. It's truly an honor. I have a Dawson trained dentist myself, and it has been absolutely fantastic. So there's two people that you may know in the Academy. One is Dr. Lenny Hess. He has helped transform my jaw health, which has been absolutely amazing. And then Dr. Shelley Bushi has also treated my teeth. And I will tell you, it is the most beautiful filling I've ever had, replacing a amalgam filling to a composite. And I recently was scanned and the doctor for some updated retainers, and the doctor was like, whoever did this composite filling, it looks so great. And I was like, thanks. So it's always a great compliment when you have another dentist complimenting, a dentist's work, right? Because dentistry is truly an art. And I believe that the philosophies around the Dawson Academy of making good dentists even better, of looking at the root cause, of creating a foundation for the dentistry, fits so well with the philosophy that we have in modern hygiene. Specifically, my philosophy around modern hygiene. I'm going to teach you a little bit of that this evening. Where I am new to the Academy, you may not know who I am. So I am a practicing dental hygienist. I have a bachelor's degree in dental hygiene from the University of New Haven and a master's degree in public health from the University of New England. I've been practicing dental hygiene for about 15 years, but I've been in the dental field for nearly 25 years now. I've been in the field. So when everything from being a floating assistant to teaching dental hygiene at colleges, everything from outreach on public health. I've been to Kenya, Romania, Nicaragua, for preventative services abroad, and I absolutely love dental hygiene. The interesting thing about my career is I actually started dental hygiene with carpal tunnel. So I knew it wouldn't be a forever career chairside. I knew that I was going to have to diversify my career in order to still continue to practice and in order to have that longevity, because at one point, the carpal tunnel was so severe that I was sticking my hand in a bucket of ice to sleep at night. Thankfully, I no longer have any pain in the wrist, and most of that wrist pain and carpal tunnel was induced from waitressing. So I thankfully no longer have to waitress. I waitressed all through high school and hygiene school to pay for school. But now my everyday looks like becoming a director of a practice called JP Dental. I also serve as a fractional hygiene director for over 4 different practices throughout the country. I do practice weekly, and I own 2 different companies. One is called Thrive in the App, where I teach dental hygienists all of the clinical and business skills that they need to really thrive in the environment of private practice. Everything from what you should be producing to time management to how to tell a patient they have periodontal disease when they've been treated as healthy for the last 20 years. Also, how to talk to the dentist about different philosophies, everything from salivary testing to air polishing. What we're going to talk about tonight isn't very, unfortunately, common in most practices. Most practices aren't using lasers and Hybenex and salivary testing and periprotect trays and practicing at the top of their scope in the hygiene department. So I really focus on how to build systems and structures within the practice so that you can start to add this on and really start building a foundation of success, because we've seen how beautiful the dentistry can be when you're a Dawson trained dentist. And my thought process is, how are we preserving that investment for the patient? So I'm excited to share that with you this evening. I also am a lecturer. I lecture anywhere from 50 to 100 times a year, often having me travel. I'm hosting my own perio summit here in Boston in October, which I'm really thrilled for, and also do consulting for corporate companies. And this little dog in the photo is Margot. She is a dental therapy dog and comes to work with me. So she usually likes to sit at the front desk if she's not with a patient. And this is what happens. She's up there greeting patients. We're trying to teach her how to verify insurance, but we haven't been able to quite handle that yet. Throughout tonight's program, if you have any questions at any point, feel free to reach out in the chat. I will be more than happy to answer questions as we go. So the future of dental hygiene, the future of dental hygiene really is no longer about cleaning teeth. It's about leveraging science, technology, and time management to elevate patient care and outcomes. And it's really focusing on the root cause of periodontal disease. When I was in hygiene school, the main focus was the calculus. But now we know the main focus around disease prevention, both hard and soft tissue, should be training that biofilm, right? It's not necessarily the patient's calculus that is causing that inflammatory burden. It's, of course, linked to some, but really it's the over 700 species of bacteria that's living in that sticky, tenacious biofilm. So the thought process here is really shifting that perspective of how are we educating the patient to reduce their risk on a daily basis, reduce their risk of plaque, reduce their risk of caries, talking about pH levels, talking about what they can do on a daily basis to reduce their risk of hard and soft tissue disease, and really changing their overall philosophy of not simply having the patient assume that they're going to have tooth decay just because their parents did. So tonight we're really going to look at innovation. Really isn't optimal. It's what is expected by today's patients. So patients are looking for more answers. They're looking for treatment that is specifically designed for their specific risks. So tonight we're going to be talking about innovation, prevention philosophy, time management, and profitability overall. I'm going to walk you through my overall process in a really short format. So we're not going to do a deep dive tonight, but it's again showing you kind of how I operate when I am chairside. So why is this important? Well, we know the oral systemic connection has been talked about for the last 20 years. Last 20 years, we've heard that there is a direct correlation between what lives in our mouth and our overall systemic health. We know that 90% of systemic disease shown oral signs and symptoms, including diabetes, leukoplakia, and kidney disease. We also know that oral pathogens can enter into the bloodstream within 60 seconds of flossing inflamed tissue and initiate a systemic immune response. We also know that treating periodontal disease in diabetes and diabetics can lower A1C levels by 0.4%, which is comparable to adding second diabetes medication. We also know that pregnant individuals with untreated gum disease are 7 times more likely to deliver premature or low birth weight babies. We also know that 50% of heart attacks and strokes are triggered by oral pathogens entering the bloodstream and inflaming the overall blood vessels. So we're doing so much more than simply scaling teeth, right? We really are prevention specialist. We know that the epithelial tissue that lines the entire body, lines the overall oral cavity is really thin, and it can tell us signs and clues that there's dysfunction. Everything from Fordyce granules. We know Fordyce granules are signs of high lipid. Redness in areas. We know that even in patients with localized gingivitis, they are having elevated inflammatory markers of their toll-like receptors, the TLR2 and the TLR4, that activates that entire inflammatory process. So any oral inflammation is systemic inflammation. So By knowing this, we should really be targeting the root cause of the periodontal disease, the root cause of the hard and soft tissue disease, which of course is going to be that biofilm. So working with patients to actually train their biofilm is a critical component. They need to understand where they're missing, right? It's not just about recommending an electric toothbrush and a water flosser. It's about checking in with that patient and seeing, are they using it correctly? Where do they have residual plaque? What type of plaque is it? Has it been there? Is it mature plaque? Is it new plaque? Is it acidic plaque? So when we look at this innovation, we're really looking at things like ear polishing, salivary testing, AI, and evidence-based hygiene, which I'm going to share with you this evening. So how I start my clinical experience with patients is I start with disclosing. By disclosing the patient, I typically do this every patient, every time. Whether it's a gingivitis patient, whether it's an ortho patient, whether it's periodontally involved. And the reason for that is because it serves as a guide. It serves as a guide for me with my air polisher. It serves as a guide for my education. And you're seeing here, there's different colors of disclosing with this product. So I can see exactly how long that plaque has been there. Is it newly formed plaque? Is it calcified plaque? Is it an overall acidic pH? This is an example of air polishing. This is the Hue Freedy Group Power Pair. This air polisher does warm the water. And what you're seeing me use for powder in this is a glycine powder. So very easy to adapt. You're also seeing that I do have a HVE present to help with that aerosol reduction. And again, super comfortable, safe and easy to use around implants, safe to use, super or subgingival. You can see how efficient this is from time management perspective. But the thing that I love the most is that glycine is clinically proven to continue to decontaminate those pockets. So not only am I being more effective with time management and biofilm removal, but I'm also helping to target those pathogens that are creating the overall inflammation. This is what the disclosing looks like. So you're seeing three different colors here. The bright blue is acidic plaque, the dark blue is mature plaque, and the lighter pink is plaque that has been there for less than 12 hours. The thing that I love about this is whenever you are working with a patient and you start with disclosing, first thing they do is start telling you about how they ran late, how they're so sorry they didn't have time to brush, how it was a busy, there was so much traffic and they couldn't get out in time, et cetera, et cetera, et cetera. But the reality here is that if this plaque is overall stained, and if this plaque is that dark purple, mature plaque is going to be a different color. So now I can say to the patient, totally understand that you ran late, but this plaque is actually mature plaque. With the acidic, I'm also going to that bright blue. I'm also going to be able to say, I'm concerned about the pH of your mouth and the ability to balance that pH. So let's talk about products that will help you buffer that pH back up and create a healthier baseline for your mouth. So it's really been a fun way to practice dental hygiene because again, we're making specific recommendations based off of how that patient presents for treatment. This is an example of the GC America Tri-Plaque Gel. It's very easy to remove with an air polisher. And again, this is the only one that I'm aware of currently that does timestamp the bacteria. As far as air polishing goes, many of us who have graduated 10 years or more think air polishing and immediately go to something like a sodium bicarbonate. The sodium bicarbonate is what we call like the OG of air polishing, if you will. And the sodium bicarbonate, if you've ever had it done, it feels like sand. It's designed to be super only. It's a high RDA. The particle size of the overall powder is thick. So it's not very comfortable, to be frank. It's developed in 1970s, it's the first air polishing powder, and it really effectively removes eccentric stains, meaning those stains that are from things like coffee, wine, seltzer, or mouth rinse that has dyes in it. And it's too abrasive for the root surfaces, so dentin and your overall restorative materials. Studies also have shown that it can compromise enamel loss when used for a prolonged state. Now, I do have an example of a sodium bicarbonate here because in cases where patients come in and they are full of stain, you do want to have an option for them, right? So I think of those patients who haven't been in for 10, 15 years. We see a ton of perio patients. Most of my patients are periodontally involved in my practice. We're a general practice, but when I tell you that 6, 7 millimeter pockets, 8 millimeter pockets are just about every other patient, we see a lot of state insurance in my practice. We're shifting more towards private insurance, and we're really headed more towards a model where we're going to be fee for service. But we bought an existing practice. And this existing practice, periodontal disease wasn't necessarily educated at our standard and the recommended standard by the ADA. So what I'm dealing with is a lot of patients who have had limited access to care. They don't really have that overall knowledge. They haven't been empowered to change their overall home care recommendations. So with a sodium bicarb, this comes in if that patient is full of stain, heavy tenacious stain. I will use this again supragingival only. Now, this is used for non-restored enamel and areas that have not clinical overall attachment loss. There are more contraindications with the air polishing in the sodium bicarb as far as that patient's medical history. So that should be noted overall. I will say that as far as the sodium bicarb goes, I personally probably use it once a quarter, if that. I typically go with my glycine powder. And the reason I go with the glycine powder is I can effortlessly switch between supra and subgingival. It's safe on all surfaces, including your root surfaces, your implants, exposed dentin, crowns, composites. It supports 95% of plaque removal. And it is a phenomenal adjunctive service for overall periodontal therapy. The RDA on this is very low. The pH is neutral to slight alkaline. It disrupts the biofilm, so it's really targeting, again, that root cause of the disease with disrupting the biofilm in deep pockets while preserving that tissue integrity. So very easy, gentle to use on that patient. And again, many devices rather on the market now warm the water. So the devices on the market that are in the air polishing kind of categories, you've most likely heard of a company called EMS. They have a unit. That EMS unit is one, they've got different types of units in regards to what powders you can use. Kayla, I did see your question on this, so I'm going to answer this right now as I'm talking. It was flashing and I was like, let me check. And of course, it's right when I'm about to compare them. So options for you are going to be your EMS. They have what we call like an airflow device, and they teach what we call GBT method. The GBT is guided biofilm therapy, where it's really showing you with disclosing exactly where to go. You can practice GBT on pretty much any device. Their kind of model of GBT is, a wheel of what to do. I practice similarly but I'm not using an EMS device. I'm using a device from Hugh Freedy Group called the Power Pair. I like this device because it warms the water. So I have a piezo on one side and the air polisher on the other. It has consistent airflow, and I can put different powders within that device. One chamber of my powders, I use erythritol. The other side, I use glycine. Where I'm going to differentiate what I use depends on that patient's overall salivary test. So some pathogens are going to prefer something like an erythritol powder, where others are going to be preferring glycine. Glycine I like for more stain removal. So because it's a little bit thicker of a particle size, it's still safe sub and supra, but it's going to help me target more stain over your overall erythritol powder. So your erythritol powder is lighter. Your erythritol powder is a sugar-based alcohol. It's shown to inhibit the growth of P. gingivalis and S. mutans. It's a smaller particle size, less abrasive, and safer for all surfaces, included some gingival pockets over 5 millimeters. The glycine is also safe for the pockets over 5 millimeters as well. often combined with chlorhexidine or antimicrobial agents, can be added for overall benefits. For me personally, I'm not somebody who believes in recommending chlorhexidine. This is simply the result of this clinical study that I wanted to show you, as far as erythritol powder has been showed equally superior efficiency compared to scaling and root planing in non-surgical periodontal therapy. Tanya says Hufredi Group definitely has a nicer unit. Yes, I agree. So sorry for my peering over. I've got multiple screens up and one of them failed me. So just navigating that overall with the technology tonight. So I put this together to show you kind of the differences quickly. You can feel free to take a screenshot here, but you have your differences of your glycine, your erythritol powder, where you can use them, kind of the antimicrobial activity there, and your overall patient comfort. I will say that your patient comfort not only is going to be centered around the powder, but it's also going to be centered around if that water is warming. And many of the devices now warm the water. I will say that I've used everything from the Action Air and Go to the Woodpecker to the EMS unit. And I will say that the Hufredi Group unit is the one that I have the least, had no issues with clogging on the unit. So always follow your manufacturer recommendations for how to care for your unit to ensure that you're not compromising the effectiveness of the device, and ensure that you are properly caring for all of those water lines and preserving that overall unit. So want to really be looking at your overall safety and care. So your safety protocols, your quality assurance, your patient-centered care overall. The results from this, again, great time management, better clinical outcomes, more comfortable patients, we're removing stain. Patients feel much cleaner as soon as we do the air polishing. They're like, is that it? I'm like, no, we still got a hand scale. However, it's really helped us save time and increases that comfort. So your sodium bicarb, super only, great for stain removal. Your glycine, really the gold standard for subgingival biofilm in maintenance around implants, healthy teeth, and easy for any clinical attachment loss, periodontally involved patients. And your erythritol is really ideal for your deeper pockets, your more immune compromised patients. And again, you can use an erythritol powder similar to what I do, where one chamber is erythritol, one chamber is glycine in my overall unit with my Hufredi Group power pair. I wanted to review a case with you because so often when I am lecturing, the question comes up, which I try to dodge all the time, because I do not want to dictate my care based off of what insurance will cover, ever. I always like to go with what is the level of disease present and how do we get that patient healthiest. But in dentistry, unfortunately, we've been trained to always look at two things of what is the cost, right? What is it going to cost the office to implement, and time, because those are two of our biggest overall obstacles in our own practice, but also for our patients. So one of the questions I always get is, well, how does this cost compare to a Prophy cup? They're two different planets. Okay, so your Prophy cup, it's going to be able to flare, it's going to be able to remove super stain, but your Prophy cup is not designed to target pathogen. It's designed to really target stain. It's not designed to decontaminate that cellular matrix. With your air polisher, it can, because what it's doing is it's releasing water with the power in a high kind of jet form, which is, of course, why you have to use an HVE with it. Your clinical outcomes are going to be better with your overall air polisher from a patient comfort standpoint, but of course, from, again, that decontaminating, detoxifying standpoint. So I wanted to share a case with you. This is a 38-year-old male, no meds, no conditions, no allergies. Chief concern, he says, I haven't been to the dentist in over 5 years. 28 teeth are intact, lower lingual retainer, and no history of restorations on the adult dentition. With the clinical findings during our full perio assessment, we found 168 sites measured and generalized 5 to 6 millimeter pocket depths. 140 sites had bleeding on probing. General bulbous and erythemic gingiva overall, distended tissues in the upper and lower anterior regions, radiographic calculus vertical bone loss, localized widened PDLs with this patient, generalized moderate to severe calculus on the lower lingual surface, and black calculus upon application with the piezo tip. I'm going to show you what this patient looked like. So you can see here lots of inflammation, especially in that upper and lower anterior. You can see the discoloration of the tissue. You can see the rolled margins. If you are airway trained, you can see, okay, tongue thrusting. You can see that overall bite where the teeth aren't completely straight up, right? So lots of tongue thrusting, lots of grinding and clenching as well, more of a clencher than a grinder. We also can see some white spot lesions. So this has me thinking about that patient's pH and overall home care. You can see here in the areas with the radiographs, we have some nice wings of calculus. I'm going to zoom in for you there as well. So you can see these wings of calculus, super fun to get off. And you can see some widened PDLs. Now, let's be honest, the bone loss here isn't terrible, which is great. We don't want to wait until the bone loss is terrible to do anything about it, right? We want to treat to prevent the disease from progressing. So when we look at this vertical bone loss here, when we look here at the distended tissue, of course, some of these pocket depths are going to be due to the fact that it's been so long since his last visit, but that doesn't mean that we should treat this patient as a prophy, right? Because they're not. This is not a prophy. So instead, we treated the patient with scaling. So we went in, we scaled the patient, we air polished the patient, super and sub. And really what we found, of course, is this is going to be able to remove biofilm more efficiently, as well as those hand instruments. Hand instruments are still required when you're using an air polisher. Doesn't mean that you can go in and miraculously, with use of an air polisher and a little bit of a piezo, you can miraculously remove everything. Instead, we want to ensure that we're going in with that explorer, ensuring that we remove all of those hard deposits, because we're not perfect on our overall removal every patient, every time, right? With our piezo. We need to have those checks and balances on the line angle to ensure that we've angled appropriately to decontaminate and to overall detoxify. That clinical case ended up coming back in 4 weeks. When that patient returned back, there was 3 sites of bleeding. The only thing that we did for the patient outside of the overall scaling was going to be that we did the glycine powder subgingivally. So I wanted to share that with you because we got an amazing clinical result with that patient simply from that overall glycine. When we look at your overall medical history for the patient, next patient we have, perio case, age 55, male, high blood pressure, high cholesterol, smokes a pack a day for the last 35 years. Last dental visit was 10 years ago. Chief concern, my tooth is loose and he's pointing at tooth number 14. This was actually a patient that was a new patient in our practice that came in while I was lecturing at an event. And the doctor saw the patient and said, well, this is fun, and I'm going to put it in Amber's schedule. And I could not have been more grateful. So this is what I immediately saw. What do you notice? What do you notice when you look at this patient? Let me know in the chat while I take a sip of water. Absolutely. So biofilm, looking at overall abfraction, recession, absolutely. Suspicious areas of perhaps bone loss. Christina, great. Black triangles. Awesome. So in a patient like this, we, of course, are concerned, right? We're concerned. We're seeing that this areas we're concerned about. We're concerned about their rolled margin. There's definitely reason to be concerned. Are we all agree? Yes. Yeah, absolutely. So again, this is not a patient that I saw first. So the amazing dental assistant was able to capture some films. This is a great opportunity for us in our practice. This was a new provider in our practice. This is a great opportunity for us to train. we immediately coach to this provider to be able to go in and adjust any of the areas in the future when when we're seeing bone loss like this, we want to do vertical bite wings. We also coached, of course, that patient where we really want to be showing to capture all of that root surface accordingly and ensure that the whole apex of the tooth is found. So personally, I was not blown away by this full mouth series, let's be honest, not to throw any provider under the bus. Thankfully, we were able to also follow up with a pan. And with the pan, you can see exactly the areas of furcation involvement. You can see some super eruption. They're concerned about 14. We're concerned about 3 as well. So this is definitely a overall patient that we want to have a tight rein on, right? This is definitely an overall patient that we want to treat accordingly because we need to ensure that we are doing what's best for that patient, always with the goal of preventing the disease from moving forward. Okay. Clinical photos, again, with clinical photos, we always want to be doing the clinical photos where we can see exactly where we are in the mouth. So I always recommend to mount your clinical photo similar how you would mount your full mouth series. So we can see lots of areas of calculus, lots of inflammation, generalized 8 to 12 millimeter pockets, class 3 mobility on 3 and 14, limited bleeding on probing. And that is mainly because that patient's smoking. So they're going to have a restriction of that overall ability to have bleeding because of the restricted capillaries. Radiographic calculus, vertical bone loss. So with this patient, when we look at our overall staging and grading, due to that information, we're going to grade this patient at a 3. And due to the smoking, we're going to stage that patient at an overall 3C. So the stage is going to be a 3 and the grade, the rate of progression is going to be a C. We went through and we actually provided salivary testing to this patient. So while working with this patient, we wanted to see what pathogens are we up against? What does this patient have in their mouth that we need to target our home care and our chairside technologies to essentially eliminate? And the interesting thing with this patient is, of course, we saw high risk of tooth decay, high risk for gum inflammation, and really low risk for that beneficial bacteria. Now, these results are from a company called Bristle Health. There's multiple companies on the market that offer salivary testing. I like Bristle Health because it goes very wide. So it's not just looking at your overall red complex or orange complex bacteria. Instead, it's really giving you an overall view of that patient. Now, this can be challenging for some offices because not every office works in a functional hygiene kind of model. However, Bristle has some great coaches that you can actually outsource to help your clinicians figure out exactly how to treatment plan. When we look at the overall phasing, so one of the other options for the Bristle recommendations is looking at the phasing of what home care products may work well with this patient based off of their salivary test. So with this patient, of course, we know that smoking reduces the responses. So it's going to increase those fibrotic tissues, which of course is also going to cause issues with or reduce the bleeding, increase the dry mouth, decrease the pH. So this is also a patient where we could consider a nitrate supplement to improve the vasodilation and immune function to the tissues that are mitigated from smoking. We want to address the overall dry mouth issues. So this is where we would consider a Periovance gel, a Xylomint, assessing the airway due to those abfractions, the attrition, the health history of the high blood pressure, the sleep study for referral, whether you're treating sleep in the practice or not, whether you're treating myo or not, always have that referral. Extensive demonstration of home care. We want to show them exactly how to remove that biofilm and work directly with that patient. Use some motivational interviewing of what does this look like with a proxy brush? Is a proxy brush something you can use? Is a floss something that you can use? What about a water flosser? And then, of course, focus on that pH balance to improve the beneficial bacteria. So things like xylitol, baking soda, and water. Assessing always, one of the big things that I always talk about is not only are we assessing for oral cancer, but we're assessing that patient looking as their mouth breathing, what's the Malin-Patty score, where we what is, if they're mouth breathing, they're going to have so many different issues, right? That I don't have time tonight to get into, but definitely things that are foundational in our overall preventative program within the Thrive in the Op community that I teach. So then we also get into kind of some AI technologies. So I've talked to you about overall ear polishing, I've talked about salivary testing, and now I'm going to talk about how we've implemented AI in our practice. So AI can be done with perio charting, as well as voice charting and AI imaging. And the real fun thing when it comes to implementing AI is it ensures that all of our providers are on the same page. Excuse me, I have time to mute. So when we look at this, we're going to ensure that every single provider sees the exact same thing. They're seeing the calculus, they're seeing some radiographic radiolucencies, they're seeing perhaps whether it's vertical or horizontal bone loss. The AI is helping us catch incipient lesions, suspicious lesions. So the beautiful thing is now the entire team is calibrated, and the dentist can determine the treatment plan from there. One of the reasons I love it, especially when it comes to your overall perio and hygiene, is it really helps with advancing your documentation for insurance reviewers. It also helps with increased treatment planning, a really smooth patient experience. I can go ahead and say, see those green boxes, and how we work in my practice is we have our overall computers, and then we have a large monitor in front of them where we can pull the monitor up and extend the overall imaging. And I could quickly say, see everything in that green box. Those are examples of the hard deposit. So that is a thing called calculus or tartar that you may have heard of. And that's calcified bacteria that is there. It's extremely rough and very hard to get off. So you can't get it off no matter how well you brush, floss, rinse. You're never going to get that. That's why I am actually employed. It almost serves as like a barnacle. It's made of calcium and phosphate. So it's made of the same material as the bone. It's really tenacious to get off. So this is why we are recommending scaling and root planing therapy or X, Y, and Z, whatever you're recommending, right, for that patient. The AI tools can also help analyze the notes and imaging and help with the appropriate codes overall. It results in fewer rejected claims and faster approvals. Depending on what software you use, there is one called a Pearl AI that has a morning huddle for you. I love this because I can quickly see who needs a perio chart, who has an area that who has a treatment plan that hasn't been completed, who has a suspicious lesion that I need to take an updated film on. So it's very comprehensive and allows me to really hone in on my time management as well as focus on more of that patient education. With insurance, of course, it also helps submit the scaling root planing claim, and it actually can or flag rather, areas of bone loss that are visible. It also can generate narratives that suggest adding specific codes and helps with avoiding that insurance denial. You also see this pink lesion here in your overall image. This can actually help us to implement things like a curodont, a remineralizing agent, chairside. So when we are working with patients, this happened to me on Monday. There was an area on the patient's upper right side, multiple areas actually, 4, in fact, sites where I was able to place a curodont. Super easy to place chairside. This prevented the patient from having to come back in, and now we are tracking it with our AI technology to see how much that curodont will remineralize. When it comes to your overall voice technology, there are technologies, everything from products like the Florida Probe to Bola AI to Ulta AI, where it uses a voice headset for the clinician to call out the numbers. I personally love this because now what it's doing is it's actively engaging the patient in what you're doing. It's not just as simple, you're typing on the keyboard with the numbers. Instead, you're calling out the numbers as you go. The bleeding, the furcation, the 5 millimeter pocket is now registered to the patient of, oof, that didn't really feel good. So by the time they sit up, they're saying, well, that did not sound good at all. What do I need to improve? And now you can seamlessly go in right to education mode. Well, great. I'm happy to provide you the solution. Instead of trying to fight that patient on, you have to make a change, you have to make a change. Now, with the overall charting in this capacity, it immediately drives them to that compliance. So this is an example of the Thrive in the Op Perio protocol. And this is what I teach in my membership community. And this is also what I teach in throughout my curriculums. So this is designed for a 90-minute new patient appointment. I highly advise that if you have the opportunity to create a schedule in your practice for 90 minutes for your new patient, minimum, it's really life changing because now you have time to really do a deep dive in that patient's medical history. You really can figure out what their motivators are. You're doing the basic standard of care of blood pressure, every patient, every time. We offer salivary testing to all patients, whether they're showing active level of disease or not, because 50% of the population has AA or PG. And we know that AA and PG are high virulence factors. So why would I wait to really target those pathogens that are so destructive on the oral and stomach health, even if they're not opportunistic right now, right? Why would I wait for an opportunity to have that patient's immune system to go down to then for them to kick in and create active bone loss? I don't. Cosmetic photos, cone beams, oral cancer screening, sleep apnea screening, your intraoral scanning, your periodontal charting, charting existings, debridement, and shedding any kind of scaling, disclosing your air polishing, varnish, laser, paraprotectrace, perhaps it's a Hygienist treatment, your clinical note, and rebooking the patient. So that is what happens in that kind of 90-minute new patient appointment, and really all focused on creating evidence for the patient to show signs and symptoms of their specific inflammatory process, whether it's soft tissue, whether it's hard tissue, using those intraoral cameras to create an environment that's showing them we're recommending things exactly based off of their specific risk. So with that being said, I'm thrilled to be joining the Academy on September 19th and 20th. We're going to be doing a co-lecture where I'll be co-lecturing with an absolutely fantastic Dawson dentist. And we're really going to be creating the foundation of what does a Dawson hygienist have to know in order to support the Dawson methodologies for TMJ health, and with a foundation of talking about the philosophies that we talked about tonight and doing a bit deeper dive into how we're protecting the restorations, how are we creating the healthiest tissue. From there, this is our first series, and from there, I'll be able to kind of teach you and expand on that preventative protocol at a future date. But this is our foundational course that we are doing. So I would love for you to join. It's going to be in St. Petersburg, Florida, and all dentists and hygienists are welcome for this. And again, really focus on helping you build your protocols chairside to really have that support for the hygienist to ensure that we're setting up the dentist for success with talking about TMJ, talking about restorative materials, and talking about long-term outcomes that are best for the patient. I would love to hear from you. This is the best way to reach me. So you can feel free to email me, Amber Auger, rdh@gmail.com, or you can find me on Instagram at amberauger.com. If you are a dog lover, Margot has her own Instagram. It's Margot Boston Westy. She's on there pretty often, just making sure I've got all of the questions answered. Awesome. It looks like I do. Let me know if you have any additional questions this evening that I can support you with. And I want to thank you again for joining tonight's webinar.